The palate. Anatomical features of the soft and hard palate. Welcome to the party. Imagine your mouth as a buzzing ground floor party filled with scrumptious snacks, tasty treats, and a muscular organ, the tongue, dancing to all your favorite tunes. It's a lively and exciting gathering where all your taste buds are invited to savor the flavors. Now, just above this lively party is another floor, the upper floor, where your nose resides. This area is more serene, like a quiet reading room or a cozy chill out zone. Your nose is responsible for detecting aromas and scents from the world around you, like freshly baked cookies or a fragrant bouquet of flowers. But here comes the unique twist. The palate acts like an open stairwell connecting these two floors. While it's not a complete separation, it does an excellent job of keeping most of the wild party downstairs and maintaining the peaceful atmosphere upstairs. Think of it as a stylish spiral staircase at the back of your mouth that lets some of the aromas from the party sneak upstairs, giving your nose a gentle whiff of what's happening below. Sometimes, when you take a big bite of your favorite food, the aromas travel up the staircase to greet your nose. Let's get into the anatomy of the palate so you can understand better. The palate is defined as the roof of your oral cavity that separates it from the nasal cavity. It is divided into two main parts, the hard palate and the soft palate. The hard palate forms the anterior two-thirds of the palate, and it is as solid as the dance floor at a club. It's made up of bone and is covered with a tough keratinized layer. Now, what are the bones that contribute to forming the hard palate? These are the palatine processes of the maxillae anteriorly and the horizontal parts of the palatine bones posteriorly. Because of its bony nature, the hard palate plays a crucial role in chewing and crushing food, getting it ready for the real taste party. When you enjoy a delicious bite, it's the hard palate that helps you savor all those yummy flavors. The upper and lower surfaces of the hard palate differ from each other because they are related to two different systems, the digestive system and the respiratory system. Therefore, the upper surface that faces the nasal cavity is covered by ciliated columnar epithelium, and the lower surface by keratinized stratified squamous epithelium with numerous mucus secreting glands. Rub your tongue against the anterior portion of your hard palate. Do you feel rough, bony ridges? These are called the transverse folds that extend laterally from a median raphe. Let's talk about the role of the palate in speech. Sounds produced when the middle portion of the tongue comes in contact with the hard palate are called palatal sounds. These sounds include sh as in measure and s as in yes. Furthermore, the hard palate also contributes to the resonance and quality of certain vowel sounds. When you pronounce vowels like I as in see or e as in red, the tongue moves closer to the hard palate, altering the shape of the oral cavity and influencing the resonant properties of these sounds. Pop quiz. Now shift your focus to the anatomy of the soft palate. The posterior one-third of the palate is soft and fleshy, and therefore called the soft palate. It consists of muscles and connective tissue. The soft palate can move, and it plays a vital role in actions like swallowing and speech. It's like a flexible curtain that can lift up to close off the nasal passage when you swallow or speak, preventing foods and liquids from entering your nose. Structurally, the anterior end of the soft palate is mostly fibrous in nature. The middle portion has muscles, and the posterior end is rich in secretory glands. At the center of the soft palate, you'll find a small fleshy projection called the uvula. The uvula is the little dangler that you can see at the back of your throat when you open your mouth wide. It is composed of connective tissue and is involved in certain speech sounds and the process of swallowing. During swallowing, the soft palate elevates and moves backward, closing off the nasal passage. This prevents food and liquids from entering the nasal cavity and ensures they go down the esophagus into the stomach. During speech, it can be raised or lowered to modify the airflow, allowing us to produce certain sounds like nasal consonants. While breathing, the soft palate remains in a relaxed position, allowing air to flow freely through the nasal passage. Which of these are the functions of the uvula? A. Articulation of speech sounds. B. Swallowing and closing off the nasal passage. C. Initiating the gag reflex. D. Production of saliva. Answer: all of the above. The uvula plays a role in speech, elevates and moves backward, blocking the opening to the nasal cavity during swallowing, triggers the gag reflex, which acts as a defense mechanism of the body, and contains minor salivary glands that contribute to salivary production. Just like the hard palate, the soft palate is also lined by two different types of epithelium. The area facing the nasal cavity is lined by ciliated columnar epithelium, and that facing the oral cavity is lined by keratinized stratified squamous epithelium. There are two mucous folds that extend from the soft palate, specifically the uvula. These are the palatoglossal arch and the palatopharyngeal arch. The palatoglossal arch is located on the sides of the soft palate and extends downward towards the base of the tongue. It helps separate the mouth from the throat. The palatopharyngeal arch is located posterior to the palatoglossal arch. It extends downward from the soft palate towards the tonsillar fossa of the pharynx. It plays a role in the opening and closing of the entrance to the pharynx. Let us understand the sensory supply of the palate. All general sensations from the palate are carried by the greater and lesser palatine nerves and the glossopharyngeal nerves. Special sensations like taste from the oral surfaces of the palate are carried by the glossopharyngeal and lesser palatine nerves. Now, what about its blood supply? The arteries that supply the palate are the greater palatine branch of the maxillary artery, ascending palatine branch of the facial artery, palatine branch of ascending pharyngeal artery. The corresponding veins drain blood from the palate and empty it into the pharyngeal venous plexus. Pop quiz. A cleft palate is a congenital condition, meaning it is present from birth, where there is an opening or gap in the palate or roof of the mouth. Normally, the left and right portions of the palate move closer to each other during prenatal development and fuse together to form a complete palate. The failure or delay in this process leads to a gap between them. A cleft palate can occur in different locations along the palate. It may involve the hard palate, the soft palate, or both. Sometimes the cleft can extend from the front, near the alveolar ridge, to the back, near the uvula of the palate. The severity of a cleft palate can vary. In some cases, the cleft may be small and only involve a portion of the palate. In more severe cases, the cleft can be larger and extend across a significant portion of the palate. It can also affect other structures in the mouth and face. For example, it may be associated with a cleft lip, which is a gap or opening in the upper lip. Additionally, the cleft can impact the position and alignment of teeth and may affect the development of the nasal cavity. A cleft palate can cause difficulties in speech and feeding. The opening in the palate can lead to air escaping through the nose during speech, affecting speech sounds. It can also make feeding challenging, as the baby may have difficulty creating the necessary suction for breastfeeding or bottle feeding. In humans, these can be corrected at an early age. However, in most other mammals, the young ones die immediately after birth due to the inability to develop a good, strong suckle. With that, we come to the end of this session on the palate. We hope you had fun learning with us.